Chapter 10 is Disability Income Insurance and Disability Benefit Programs. Our lesson objectives discuss the history of disability income insurance, describe benefits and exclusions contained in individual and group disability income insurance, name and describe federal disability benefit programs, differentiate between SSDI and SSI, state eligibility requirements, benefits, and limitations of SSDI and SSI. Explain disability benefit programs for disabled active military personnel, veterans, and their dependents. Name states that have state disability insurance plans. State eligibility requirements, benefits, and limitations of state disability plans. Explain voluntary disability insurance plans. Describe topics and contents of a medical report. List guidelines for federal disability claims. Explain procedures for state disability claims. Recognize forms used for processing state disability plans. So disability plans provide disability income insurance provide benefits under certain conditions when the insured is unable to work as a result of illness, disease, or injury. Does not provide benefits if the insured is unable to work as a result of a work-related event. That would fall under workers' comp. Disability income insurance does not cover costs of medical care, for example, medical expenses, but it does provide income only. The history in the 1880s was the emergence of disability income policies for accident and illness. In the early 1900s was the first non-cancelable policy. 1956, Congress extended Social Security program to disabled adults over 50 years old. And in 1965, Social Security program expanded to cover workers regardless of age. The Paul Revere Insurance Company introduced the first non-cancelable policy that guaranteed income and no premium increases. In order to be covered for disability under the Social Security program, certain conditions must be met. Now, disability insurance is offered through private and employer-sponsored plans. Federal and state programs are available for the disabled. For disability income insurance, individual plan provides specific income if disabled. The insured pays premiums. Medical expenses are not covered. Disability must not be work-related, and the insured must meet specific policy criteria. Individual policies usually end when the person retires or reaches a certain age. Each policy can be written with specific exclusions denying or limiting coverage for certain situations, such as pre-existing conditions, self-inflicted injuries, or mental conditions. With a waiver of premium in the contract, the premiums are paid by the insurance company if the person becomes totally and permanently disabled. During the waiting period, the disabled individual is not eligible to receive any benefits, even though he or she is unable to work. And the waiting period is the time from the beginning of disability to beginning of the first benefit payment. And the benefit period is the maximum span of time that benefits will be paid to the disabled party. They can range from 1 or 2 years to life, depending on the specific policy. Oops, sorry. The benefits include residual benefits, benefits paid if disability is partial or limits the capacity to work full time, supplemental benefits, specific provisions that may increase payments. Supplemental benefits may include a cost of living adjustment that is factored into the policy when it is written. Then we have accidental death and dismembered Dismemberment benefit, special clause addresses accidents that result in death or permanent disability. Some policies will distribute a portion of the premiums if the policy is maintained for over 10 years with no claims filed. Double indemnity policies will pay twice the face amount to beneficiaries in cases of accidental death. The types of disability, we have total disability, where the person cannot perform most normal work duties. Partial disability, the person cannot perform all normal work duties. And temporary disability, person cannot perform all normal work duties for a limited period of time. These definitions vary greatly by specific policy. Usually in total disability, the person can no longer perform the major duties of his or her specific occupation. And also another name for partial disability is residual disability. Clauses are where policies can be guaranteed renewable or non-cancelable with a waiver of premium. Exclusions, examples are pre-existing conditions, mental conditions, or other disabilities. And for AIDS, HIV, consent and notice form is needed for testing. Under a waiver of premium, the policy pays all premiums while the employee is disabled. Exclusions are provisions written into the insurance contract denying coverage or limiting the scope of coverage under the insurance policy. States govern the use of questions related to AIDS and HIV in the insurance application process. For group policy, some employers offer group insurance as an optional benefit. Contracts are between the insurer and the employer. The employer pays premiums with or without employee contributions. The policy terminates when the employee leaves the company. The employees are not the policyholders. They hold certificates of insurance. Benefits can be for short-term or long-term disabilities. Benefits are taxable if the employee is not making any contributions toward the premiums. Exclusions, such as those in individual disability policies, are also usually present in group policies. Disability benefit programs include Social Security Disability Insurance, SSDI, Supplemental Security Income, SSI, Civil Service Retirement System, CSRS, Federal Employees Retirement System, FERS, Armed Services Disability, and the VA Veterans Affairs Disability Program. The Social Security Administration has two different programs that pay monthly benefits to disabled persons under age 65, and those are SSI and SSDI. In both programs, the severe disability must be for at least 1 year. The Disability Determination Service, DDS, makes the determination as to which, if any, Social Security program may provide benefits. So for SSDI, Social Security Disability Insurance, long-term plan that provides benefits to workers and self-employed who meet eligibility criteria. The insured also may be eligible for Medicare after 24 months, converts to retirement benefits at age 65. Workers must be insured in accordance with SSA guidelines in order to receive SSDI. Those eligible to receive SSDI include disabled workers younger than age 65 years and their families, individuals who become disabled before age 22 if a parent who is covered under Social Security retires, becomes disabled, or dies. Disabled widows or widowers age 50 years or older if the deceased spouse worked at least 10 years under Social Security. Disabled surviving divorced spouses older than age 50 years if the ex-spouse was married to the disabled person for at least 10 years. And blind workers whose vision in the better eye cannot be corrected to better than 20/200 or whose visual field in the better eye, even with corrected lenses, is 20 degrees or less. For SSI, Supplemental Security Income, This is long-term disability program that provides benefits to adults and children regardless of employment history. Many people also qualify for Medicaid. Benefits are intended for those with limited income and few other resources. Those eligible to receive SSI benefits include disabled people younger than 65 who have limited income and resources, disabled children younger than 18 years if the disability compares in severity with one that would prevent an adult from working and has lasted or is expected to last at least 12 months or result in death. Blind adults or children who have a visual acuity no better than 2100 or have a visual field of 20 degrees or less in the better eye with the use of corrective lenses. Work incentives exist that allow disabled or blind people receiving SSI or Social Security payments to still work within limits. Next, we have CSRS, Civil Service Retirement System, and FERS, Federal Employees Retirement System. These benefits are payable for life to individuals who qualify. CSRS requires 5 years of service. FERS requires 18 months of service. Then Armed Services Disability. Benefits are payable for life if disability occurs or is aggravated while the person is on active duty. Armed Service Disability payments are based on years of service, base pay, and the severity of the disability. Next, we have VA, Veterans Affairs Disability. Service-connected disability is eligible for outpatient treatment if filed within 1 year of injury. Non-service connected disability may be eligible for same benefits if criteria are met. Criteria change frequently for VA benefits. You should consult a current booklet or VA website. If a VA facility is not within a reasonable distance, the veteran may see a private physician. The physician must notify a VA facility of proof of medical necessity within 15 days of treatment. If more than 15 days, physician must use Form 10583, which is a claim for payment of cost of unauthorized medical services. State disability insurance. Non-industrial disability insurance programs exist in only 5 states and Puerto Rico. It was started in Rhode Island in 1944 and California in 1946. It also exists in Hawaii, New Jersey, New York, and again Puerto Rico. To fund the programs, a percentage of wages is deducted from paychecks or the employer pays the plan costs. Eligibility ceases upon retirement. Many workers are excluded from coverage, including employees of nonprofits, churches, schools, and domestic workers. Eligibility requirements vary greatly between states, and restrictions are very specific. You should become familiar with the rules and regulations for your state. Restrictions include time limit for filing exceeded, condition covered under workers' compensation insurance, unemployment benefits beyond a specified amount, or the employer has a voluntary disability plan and does not participate in state plans. Voluntary disability insurance. This is designed for people who reside and work in states without state disability insurance programs. Local private insurance carrier arranges coverage, and if disabled, insured receives fixed weekly or monthly income, usually for 6 months. The disability becomes permanent, the person may qualify to receive small payments for life. Residents of states without state disability insurance programs would be expected to seek out this type of insurance. For disability income claims, the person must provide completed proof of loss to establish disability. The attending physician usually must complete portions of this form, and the medical report may be attached to the form for additional explanation of disability and treatment. Additional reports or claim forms may need to be filed monthly or weekly if the disability continues. An independent medical examiner may have to validate the disability, especially if the condition is prolonged or circumstances are questionable. Patient's authorization to release medical information must be on file from the physician before these documents are prepared and released. For federal disability claims, the Social Security Administration has a teledictation service for physicians to dictate medical reports directly over the phone. Only data less than 1 year old is allowed. Prognosis should be based on medical findings, and claims should include functional assessment of work related activities. Typed transcripts are sent to the physician for review and signature. Functional assessments include the ability or tolerance to sit, stand, lift, bend, speak, reach up, or travel if the job requires. In mental impairment, assessments may include memory, communication, and social interactions. For VA disability outpatient clinic claims, the processing of claims is usually long and complicated. Consider billing VA monthly to avoid payment delays and follow instructions on the patient's ID card closely. Private physicians may bill the patient directly. Patient then submits claim for reimbursement, and the same guidelines must be followed. Keep terminology consistent with what is shown as diagnosis or condition on the ID card. Patient's name used in the medical bills should be exactly as shown on the ID card from the VA. For state disability claims, residents of states with disability benefits must obtain claim forms from the nearest state filing office. The physician must substantiate the disability for claim to be processed, and additional forms and filings may be required if disability is prolonged. Time limits for filing must be strictly adhered to, or benefits may be denied. The SSA number, last day worked, and first day of disability, where the person was too sick or impaired to perform the duties, must be included. The patient must report any income received to the state disability insurance office because it may affect the benefit allocation. Figure 10.3 through 10.7 in your book show examples of the following forms. We have state disability claims form DE 2501, a claim for disability insurance benefits, a physician practitioner certificate, form DE 2525XX, notice of final payment, and physician practitioner's supplementary certificate, form DE 2547, request for additional medical information, and form DE 2547A, a medical inquiry. Again, in your book, figures 10.3 through 10.7 are examples of these. Our summary for this chapter: disability income insurance is a type of insurance that provides periodic payments under certain conditions when the insured is unable to work because of illness, disease, or injury, not as a result of a work-related accident or condition. While disabled, benefits begin after elimination or waiting period. The types of disability are temporary, residual or partial, and also total. Disability policies may be guaranteed renewable for a specific number of years to a certain age. The Social Security Administration manages two programs that pay monthly disability benefits to people younger than age 65 who cannot work for at least 1 year because of a severe disability: Social Security Disability Insurance, which is SSDI, and Supplemental Security Income Program, which is SSI. Federal employees who have put in a certain number of years of service and who become disabled not by work-related means may be eligible for Civil Service Retirement, CSRS, and Federal Employees Retirement System, FERS. Individuals on active duty fall under the Armed Services Disability Program if they become disabled while serving in the military. The VA Veterans Affairs Disability Program provides benefits for veterans who have suffered a service connected disability. 5 states plus Puerto Rico have a state disability insurance SDI program for those who suffer a wage loss because of off the job illness or injury. Claims for SDI must be filed within the time limits of each state's laws. For disability income claims, the insured must file a proof of loss form, and the attending physician must also complete a section to verify the disability. For federal disability cases, the physician must submit details about the individual's disabled condition. State disability claim forms must be completed by the attending physician in order to substantiate the claimant's condition to receive benefits.